Hello listeners, welcome to Views on Health. A great pleasure to have with me on the program tonight Dr. Mihira Manamperi, consultant pediatrician, Sri Jayavardanapura General Hospital in Kotte. A warm welcome to SLBC and our studio, Doctor.
Thank you very much, Fatima, for having me here today.
And it's for the information of our listeners, we have Dr. Mihira Manamperi being featured on the program for the first time. So it is indeed a double pleasure, Doctor. And having said that, the topic under discussion tonight is fever in a child. In your capacity as a consultant pediatrician, when you say fever in a child, does it mean just a fever that when a child can be slightly kind of warm, or is it a high fever, or is it related to something? So from that point of view, Doctor, we as lay people would like to know how you would describe fever in a child, and what would a parent or parents having a child with fever do or should do at the very outset.
Okay, first of all, I must say fever has become one of the most common presenting problem to medical consultation. It is not only in Sri Lanka, worldwide, it is the most common presenting symptoms. Parents would take their kid to a medical practitioner, general practitioner, or to a pediatrician, or to an emergency department. So, fever has a lot of definitions. So, just being warm to touch may not be just fever, but both England and Australia has now clearly defined fever is anything about 38 cells of 38 cells Celsius. So if you find your child's fever is not, it's just a symptom. So it is a symptom which tells us the baby's body is trying to fight with some sort of a foreign virus, foreign bacteria. There could be some underlying etiology for fever. So the moment if you detect fever from your own thermometer, you can use various types of thermometers at home. It could be mercury thermometer, or it could be forehead thermometer, or you can use thermometers through your earbud, as well as underneath the tongue, underneath the armpit. So there are many ways of checking the temperature. So once you get the temperature, that should alarm you that the child is developing some sort of an infection. So just a fever per se, it is not an illness. So very first thing, I think what you ask about this question, what should they do? I think what they should do, if we find if the child is having fever up to 38, all they need to do, give the correct dose of paracetamol and see the response.
Thank you, Doctor. Now when you say 38 degrees Celsius, and that is what we know of, that is the time when the parents should take note and
absolutely,
and do what is needed initially, that is to give the paracetamol and see how things develop.
Yes.
Otherwise, what is the normal level of temperature of the child?
So usually it's hovering from 36.5 to 37.5. So different individuals, the babies have different level of temperature. So if it is something, yes, I have during my consultations, the hospital visits, many are telling my child is having fever. We document it, and then they say it's 37.1 repeatedly. So they need to know some of these values. It's just anything above 37.5, you can call it as mild, low grade fever. But if it is definitely above 38 Celsius, you can call it as fever. So something in between 36.5 to 37.5, if you check repeatedly, if you are getting the same values, I don't think they need to panic over it.
So, Doctor, you said this is common, and yes, we know of children, they are susceptible to various infections despite being given the various vaccinations. They are immunized against various diseases, and they are on vitamins, they are taken care of. Yet they tend to catch a bug from somewhere.
True.
And how that happens, we don't know. But having caught the bug, then obviously the child will react. So if the paracetamol doesn't work, as you said, what should the mother do, or father, or the parents together, and for how long should the paracetamol be administered before they think, well, the fever isn't going on or it's recurring. When
Yeah,
you
well,
give
it's-
it can come down, it comes back. Now, do we need to see the doctor?
Well, it's a very important question. So, I mean, the first go, you can just give paracetamol and see the response. So, if the fever is recurring or if the fever is not getting down with paracetamol, and I mean, most of these days, so in Sri Lankan context, so we do quite a few patients with influenza virus, and we do see quite a few with dengue again. I mean, dengue infection again on the rise, and recently we had a lot of COVID patients. So apart from these three, there are so many other viruses as well. So these I mean, the first symptom of fever could be most likely due to underlying viral infection. I'm using that bracket word called most likely because there are other infections as well. There are bacterial infections which are too nasty. So what they should do, for the first go, I mean, you should give paracetamol and say how the child responds. So if the fever is coming down, they can, I think, happily continue paracetamol at least up to 24 hours, 6 hourly, and see the response. So I think this time I would like to use this time. I mean, here and there we can see a lot of general practitioners prescribing what you call non-steroidal anti-inflammatory drugs. So if I tell you some names, I'm sure you have heard of it: Brufen, mefenamic acid, and these diclofenac suppositories. They have these antipyretic properties, and if you are travel to another country like Australia, England, they do, I mean, along with paracetamol, they prescribe Brufen very frequently. But remember, unlike in other countries, we are a country, dengue fever is endemic to us. So what we have found, I mean, what we learned over last decade, those who have received Brufen, diclofenac suppositories, or mefenamic acid syrups as an antipyretic, they didn't do well if the etiology of fever became dengue. I mean, quite a few pediatric dengue deaths happened over last decade purely due to using those medications. So my advice is, you may continue only paracetamol. That is again the correct dose. So the correct dose is, you can use paracetamol 15 milligram per kilogram per body weight. Say, for a simple example, if you have your baby is just 8 kilos, so if you work it out, if you multiply 15 into 8 is 120 milligram. So 5 milliliters of paracetamol has 120. So what you can give is only 5 milliliters of paracetamol, not beyond that. And the frequency should be every you can give 6 hours interval, not any shorter. So the other thing with dengue, we always come across mothers tend to give more and more frequent paracetamol, and they ended up getting what you call paracetamol overdosage. I hope I answered to your question.
Thank you, Doctor. That's very important message for our listeners, that parents or adults, caregivers, should not increase the dosage for whatever reason. If the doctor has said it's every 6 hours, which I think even adults are told the same thing, unless they are prescribed medication for other reasons that may be more frequent, but basic medication, paracetamol, is every 6 hours, and that's something for our parents to make note of, and not overdose your child with the perhaps a good intention of saying, my child will get better faster if I give more paracetamol or more frequently. But that can be detrimental to the child's well-being and health. Am I right, doctor?
Yes, you are absolutely correct. So it is fever is just a symptom, and you don't have to, I mean, completely eradicate or subside fever. So let it be there. If the child is, I mean, drinking and feeding despite of fever, playing around, so doing some response to a paracetamol, just don't try to over enthusiastically try to treat the fever.
Before we move on to how you would treat a child who might be having a fever that is continuing despite the paracetamol, and then they have to get medical attention, a question that in that period the child can have normal food if he or she wants to eat, and obviously a lot of liquids. Is that advisable, doctor?
Absolutely. So, when you have fever, that means child is trying to fight against some sort of an infection. As I said, most likely it's a viral infection. So, all you have to make sure the child is, eating well, drinking well, and getting enough fluids. So, most of the cases, what will happen with this high temperature, they don't feel like well. So they become lethargic, they become drowsy, and they, here and there, they might start vomiting. With that, they won't drink at all. So the hydration, maintaining a good nutrition is, essential during the first 24 hours of fever. You need to keep it in mind. Sometimes fever will not completely settle within 24 hours. So for the first 24 hours, all what you have to do is you can try some Jeevani and oral rehydration solutions. So there are so many preparations available in pharmacies. You can directly buy without a prescription even. So try them. Give some adequate dose of paracetamol. Don't try to give anything apart from paracetamol to bring down the fever. One thing I forgot to tell always, if your child is not keen to drink paracetamol syrups, there are two paracetamol suppository preparations available. One has a strength of 125 milligram, other one is 250. I'm sure, you can just round up one of the paracetamol suppositories would fit into your child. So if the child in a deep sleep, do not disturb to give syrups. Instead you can insert a suppository that has better, more effective than paracetamol syrup. So just go on like that for the first 24 hours.
Thank you, doctor. Now, going on from there, assuming the child's fever hasn't gone down or maybe even increasing, can go beyond 38 and can go to 39. One does get alarmed then. What does one do when they see the doctor at that point in time?
Yes, I think you can observe at home if the child seems to be fine up to 24 hours. I must tell you, a different country, if it is in Australia or England, I would say, they can continue a little longer. But here the problem in Colombo and the Western Province, not only Western Province, Gampa, wherever you go, dengue is, prevalent in Sri Lanka. So we need to make sure if the fever is going up and up, and it doesn't really responding well to paracetamol, and if you feel like your kid is going down a bit, so always at the 24 hours mark, better to consult your general practitioner or your favorite GP. So they can listen to the baby's lungs, they can assess the hydration levels, they can check the pulse, and depending on the risk factors, they might as well considering doing some blood tests, because now we have in dengue we have this NS1 antigen test which is available in the private sector. You can get it done, and closer to 90% you can clearly say, if you do it on the right time, it's between 12 hours to 36 hours, you can clearly say whether the child is having you are dealing with dengue or not, which you need more meticulous monitoring.
Thank you, doctor. So assuming it's dengue, or it's even not dengue but another fever, viral fever, how would you treat it?
In case of another viral fever, it's up to the symptoms what they have. So almost all these influenza virus, COVID virus, and there's some other viruses called respiratory syncytial virus. So all these viruses are, they can cause a lot of respiratory symptoms. So baby will develop some cough, coryza symptoms, sneeze. They might complaining of sore throat. So we have geared in this country. We have geared to do what you call symptomatic treatment. So if you go to your general practitioner, so he will assess the child. He will examine the throat, he will examine the ears, as well as you will listen to the lungs. If there are lung signs, if you are having cough, in Sri Lanka, this part of world, Sri Lanka, India, we are all into what you call symptomatic treatment really. So we do prescribe. So of course in the Western world they don't prescribe anything apart from paracetamol and Brufen. And we might prescribe some antihistamine syrups, some cough syrups, which will actually help to relieve those symptoms, and child should get better very early. So always, I mean, you can if the symptoms, if there are other symptoms, say if the child is having diarrhea, so there are various preparations we can use, and we have been practicing, and we have our own personal experience that if you have these medications, the durations of symptoms are lesser, so likely that your child is going to recover fast. I think being parents, what you all want is that, I mean, I know if a child is sick at home, your whole I mean the whole family can't really progress. The father can't go to work and mother can't go to work amidst this economic crisis. Having a child sick for ages is not something what you all want. So that you go to a decent doctor, I mean, he can prescribe certain medication according to, apart from this virus fever, there may be viral fever, there may be other symptoms. So they will give some symptomatic medications to feel your kids better. So yeah.
At which point in time would you think, or would you say that the child has got to be in hospital?
It depends. I mean, if your child is, say, for instance, so you work for 24 hours, you give paracetamol, there's no improvement, so you visit a GP, and these doctors have, I mean, trained in such a way that they can assess a child and say whether the child is sick. So we go by several parameters. We will check the baby's pulse, assess the hydration level, as well as we might listen to the lungs. So if there are lung signs, if the pulse rate is rather high, if the child's hydration is not good, if the child is throwing up all the food or whatever the liquids, that means that's a time you might have to get admitted under a decent hospital and get some hospitalized care. At the same time, you never know, on day 2 you do this basic blood test, so all will appear as viral, and dengue is also a viral infection, so your dengue test could become positive. So then of course again you need to consider early admission, because in dengue there are 2 varieties. One is dengue fever, other one is dengue hemorrhagic fever. So at the beginning of the febrile illness, we can't really say which one is which one. So it could be either dengue, it could be either dengue hemorrhagic fever. It will decide on what you call latter part of this fever illness. I mean, it could be on day 4, 5, 6. So if you detect, I mean, if the child is having dengue, if you diagnose to have dengue, it is better to having a close contact with a pediatrician or a hospital for the rest of the ailment.
When you talk of dengue, there are certain symptoms and also maybe certain sort of other difficulties the patient can have because of the virus. Could you describe those, doctor?
Yeah, I mean, it's dengue, compared with the normal other viruses, dengue fever, usually you get very high fever. I mean, you call it as it's a remittent fever. So most of the time, parents would give paracetamol, but there won't be much improvement for paracetamol. Say the fever goes up to 104 Fahrenheit, but after giving paracetamol 2 hours down the line, fever still it's at a level of 102. So one is very high fever, and in a bigger child, say above 5 years or so, they should be able to say other symptoms. So they will have what you call retroorbital pain. So they will have behind the eyes there will be a severe pain, and they will be having headache as well as a lot of body aches. So if you have body aches, so if the child is difficult, doesn't look all right, having very high fever, and sometimes they don't feed at all, so easily they can have abdominal pain as well. So if the child is showing to your right upper side of the tummy, so easily dengue can cause what you call liver enlargement, liver involvement. So then they will have abdominal pain as well, and on top of that they can have some bleeding manifestations. So there will be gum bleeding, there will be a little bit of urine, the blood will pass from the urine. If it's a girl who's attained menarche, if she's menstruating, they will have bit of a heavy menstruation period. So all are more some of the symptoms, I would say, specific for dengue.
Thank you, doctor. So that sort of gives a clear picture as to the symptoms and what parents can be alert to and get medical attention. So if it's dengue, you would hospitalize the patient?
I think you can, up to, if the parents are so sensible, probably up to day 2, day 3. So the dengue is all about, it's you go by the platelet counts. So from day 1 to day 3, day 4 onwards, platelet counts gradually comes down. So the main worry is, as I said, Fatima, before, we can't really differentiate dengue fever from dengue hemorrhagic fever, which is the devastating one, or which can even kill your child at the beginning. So we would like to see, if you can't really admit, at least you have to have a good, reliable general practitioner or a pediatrician. You follow up under him, so he may do what you call twice daily full blood count. So by day 3, day 4, my understanding is, I think once the platelet count drops up to 150,000 or less, it is always better to be in a good setup, hospital setup, where there are a set of doctors, well-trained doctors, as well as well-trained nurses, who could monitor your child carefully. So it is the good thing about dengue is it's not going to last forever, like a bad pneumonia or a bad urinary tract infection. All what you have to monitor them probably from day 3 to day 7. So that's about 4 days. You can give a almost completely recovery.
In the meantime, even in the hospital, if the child is able to eat, is the child fed? Or otherwise, do you put the child on a drip?
It depends. If it's a bigger child, of course, during the dengue monitoring, we will give you a calculated amount of fluids the mother has to dispense. So if it's a 20 kilos, we might as well ask to give 40 milliliters of fluid. It could be Jeevani, it could be any other oral rehydration solution, or it could be apple juice, whatever. The amount is, just 40. So they are supposed to maintain a chart what they have given, as well as they are supposed to monitor the urine output. Probably we need frequency of at least 2 hourly to get the correct urine output. So what we do is, we as doctors, we are monitoring some other parameters. We are closely monitoring the baby's blood pressure and checking the pulse rate per minute, and we check the pulse volume, how we feel to our hands, and we also going by the urine output per hour, and as well as we check the full blood counts, and we also do what you call PCV monitoring, or the packed cell volume monitoring, or the hematocrit monitoring. So we go by several other parameters. So if these parameters are heading towards dengue hemorrhagic fever, in Jawaharlal Hospital we do have the facility to do ultrasound scan. So we can ultrasound is the most sensitive tool to diagnose dengue hemorrhagic fever, so we can detect it very early. So then this what you call dengue hemorrhagic fever has a period of 48 hours approximately, what you call it critical period, or the leaking period, where your plasma leaks out from your intravascular compartment, from your blood vessels to the this tummy, as well as to your chest cavity. So what we do is, once we identify this child as dengue hemorrhagic fever, we have to escalate our monitoring more frequently. I have to tell you, the doctors are giving a tremendous lot of work for them. So they are virtually monitoring all these babies hourly basis till they recover.
So it is safe and sensible to have the child in hospital, in the sense, obviously if the doctor says the child has to be admitted, the parents have to comply. Unless the doctor says you can do this at home, but make sure you take care, you follow these steps and monitor the child. In the hospital, doctor, you spoke of checking the pressure and the pulse. How often do you do it?
At the febrile phase, if we haven't diagnosed it as dengue hemorrhagic fever, we do at least these monitorings every 2-hour basis. But once they enter the critical period, we do it more frequently. So sometimes if the child is sick, really sick, we might as well doing every 30-minute intervals. So likewise, we have to escalate depending on the case. Different patients behave differently.
Obviously it's differ from patient to patient, but it's, as you said, it seems a lot of work put in by the medical personnel, from the doctor down to the nurses and maybe others helpers who might be there, medical personnel who will be assisting in the wards. Dr. Time has caught up with us. What is your take-home message?
So my take-home message, I would say, I mean, we are in the month of January 2023, and I'm actually attached to Jayawardenepura Hospital. I know Nigamba Hospital, Gampaha, all these hospitals, I mean, getting a lot of patients with dengue. So if your child is having fever, keep it in mind whether this could be dengue. So my advice is watch for 24 hours at home with paracetamol, and then by second day onwards, don't keep the child at home. I know you all you're leading a very busy life amidst these all issues, but make sure that your baby, I mean, you have to get the consultation from a decent doctor or a pediatrician, and then take from there onwards. If it is dengue, if the doctor is suggesting for an admission, don't hesitate it. I mean, what we have witnessed over the last 13 years or 14 years into pediatrics in my career, those who did not present early are the ones had all these complications and ultimately, I mean, lost their lives.
Sad to hear that, but on that note of advice, we end this interesting discussion on fever in a child. Thank you so much to you, Dr. Mihira Manamperi, consultant pediatrician, Sri Jayawardenepura General Hospital in Kotte, for sparing your valuable time and sharing your expert knowledge with our listeners on the program. Thank you, Doctor.
Thank you very much, Fatima, for having me here today.
Our pleasure, Doctor. My thanks also go to Nadika Jayasekara for technical assistance. I'm Fatima Razi Khada saying good night and looking forward to your company next Monday, same time on Views on Health.